Lower back pain. According to the World Health Organization, in 2020, 619 million people around the world suffer from lower back pain. WHO estimates by 2050 this number will reach 843 million people around the world. In the United States, 45% of adult population at least one time in their life suffer from lower back pain. That's staggering numbers. This video we'll discuss today will tell you what patients need to do to help therapists dramatically increase effectiveness of the therapy and eliminate lower back pain. My name is Dr. Rost. I am founder of Science of Massage Institute located in Phoenix, Arizona, and in our educational program we help therapists around the world to use medical massage efficiently, and all information we share based on the science and clinical expertise from the different sources. Lower back pain and the treatment of the lower back pain indeed is complicated matter, because lower back pain by itself is the consequence of something, and many different reasons can be contributing to that. It can be problem with the disc, it can be spasm in the quadratus lumborum muscle, it can be fascial tension, it can be trauma. That is different subject. But if trigger was identified correctly by the therapist, and therapists now actually start to do therapy, that's only 50% deliverance. Another 50% come from the patient, what patient does at home, and what we'll discuss right now is what stretches at home patient need to do to help therapists to reset everything, and the same stretches patient will do for the rest of their life, one time per day after hot shower, to prevent problem with the lower back. I will ask our Director of Services, Julia, to help us with the visual presentation. Stretch number one. Patient need to be on the hard surface, floor or mat, not in the bed, because then he or she will sink. It will decrease effectiveness of the stretch. So what you ask them to do is to bend the knees and grab each knee separately with the hands. And at this moment, here is the critical factor. They need to be sure that lower back is completely relaxed. How they do that? They do two things. First, they check if everything relaxed here, and they check if everything relaxed there. Only when they control position of the knees with their arms, they will use only power of the arms to stretch lower back during long exhalation. So inhale through the mouth and compressed lips. She brings knees to her chest, pushing air out of the lungs. Inhale, and as you can see here, pelvis elevated with that. So you're using knees as a way to stretch lower back muscles during passive stretch by her own hands. Inhale, slow, completely, 5 times. After that, if the patient has pain on the right side, she will put right leg straight and grab the left knee with the right arm. Before she do anything, she need to be sure that now gluteal muscles relax. So she moves, which allows her to control and do everything with the right arm. She inhales and she stretches 45 degrees to the opposite shoulder. When air needed, then she releases pressure. Inhale and then do exactly the same 5 times. After that, she grabs affected side, inhale and bring it to the opposite side. 45 degrees, knees goes. Stretch number 3, which it requires rotation. This stretch can be added later. You don't start with that, because first 2 stretches will be enough. And then for the third stretch, which you add when the symptoms start to decrease in intensity, then you ask patient to do it on the bed. This is affected side. She is on unaffected side. Leg is straight, foot supposed to be behind the knee, and the affected knee slightly hanging from the edge of the bed. This arm control position of the knee. Now the arm, weight of the head and weight upper body used as a counterweight. Now Julia inhales, and then she rotates and look backward, controlling the knee. That's why it needs to hang from the edge, because she uses her knee to stabilize, lift it up. Inhale, and if there is no control, that knee will go with the pelvis and there is no stretch in the lower back. And she does that 5 times. She just drops her arm and lets force of gravity do stretch. There is no actual movement. Lift it up, inhale, and then just drops. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you, and see you in the future. Mistakes. This is equally important component of the stretch. So, first of all, when patient grabs knees, as we discussed, they need to be sure that all muscles in the lower back relax. Secondly, when they stretch, you don't want them to lift upper body, squeeze everything, and work very hard. It's almost like a yoga. So she inhales, as you can see here, and gently bring it to the chest without this extra squeeze from the shoulder and the middle back, which will also engage lower back as well. So this is why it's very relaxing stretch. Secondly, Julia doesn't have pain right now, but the patient who in severe pain sometimes even stretch from here to there already painful. So this is why they need to be explained that they do stretch only within comfort level. If the comfort level only this, that's completely fine. So however, if this is the stretch, that is the pain threshold which brain established. Patient cannot override pain threshold. Brain will block everything and make everything even worse. So from that point of view, how they work? They work with this stretch only. So let's say she inhales and then slowly bring, and now she starts to feel pain. She continues to exhale, but she holds the pressure. She needs to inhale, she releases, and when she exhales, she brings and hold to the level of threshold and wait until all air is gone. If it's done right, I guarantee 100% that at some point she will be able to get a little further. So she moves pain threshold from the repetition of the stretch, which allows to reset muscle spindles receptors, disable nociceptors or pain receptors, and restore the function. So from that perspective, you have 3 stretches, both knees, one knee, another knee, and the lateral rotation. And rotation needs to be done only on affected side. And that's what patients need to do at home between the sessions. These stretches in the future, all my patients do as a preventive measure. But between the sessions, they need to be done frequently, every 2-3 hours. They need to be done after hot shower, 2 times per day in the morning and the evening, better even 3 times per day, morning, afternoon, and evening. That allows slowly elongate muscle fascia and help therapists to reset system and restore the function. Without proper execution of these stretches, that therapy will never deliver stable clinical outcome. I hope you enjoyed the video. If you have any questions, please leave comments below, and I hope we see each other again. Let's work together to bring your practice to the new level of medical massage to help patients in need. Thank you very much and see you in the next video.